Hi, we're in Helia Healthcare of Champaign today, and I'm with the community liaison, Carrie Wright. And Carrie, tell me what your role is here.
My role as the community liaison here at Helia Healthcare is to help people transition from acute care to a post-acute care when therapy is a need.
Now, is that working with both the patient and the family?
Absolutely. Actually, I'm going to work with the hospital discharge planners. We're going to work with your insurance. We're going to work family and the resident that's going to transfer.
When somebody's looking for a facility like this, what's the top 2 or 3 things they should be looking for?
Well, first off, they're always concerned about payment, and so we're going to verify your benefits. And what they're looking for is the very nice amenities that we have to offer, such as private rooms, great therapy, and a safe place to be.
And not to mention a great cafeteria with good food.
Absolutely, food helps.
So what is your biggest challenge in trying to find the right opportunities for these people?
Maybe the biggest challenge is for them the experience, because it is an adjustment to be in a hospital or be at home or in assisted living and have to come in to a place and get therapy. And so it's a lot of work to do, and so my job is to help them transition and be comfortable in the setting. And so I try to give them the big picture so that they feel good about coming here.
And your friendly staff really makes them feel like this is a family.
Absolutely. We are one big family.
I'm joined now by Michelle Hogan, the Director of Nursing here at the Helia Healthcare of Champaign. And when people come into the facility, what kind of things do you do to make them feel right at home?
Well, that actually starts prior to their admission with Carrie, our community liaison. But once they get to the facility, we make sure that they're comfortable. We make sure that they have all of the medications that they need. If they're having pain, we can get them medicated for pain right away. Everything that we do is all about the experience for our guests here on our ARCH unit. Full staff of nurses and CNAs that are very attentive and welcoming to our residents and take the best care of them that they possibly can.
And what do they look for when they come in as far as, I mean, I know everybody's different, but what kind of things do they look for to help the person get them to be able to leave?
Well, we have 7-day-a-week therapy. They are able to participate in therapy 7 days a week. We have excellent machines and equipment in our brand new therapy room. We also have, as I said before, our nursing staff that will take care of any of their medical needs.
And what kind of therapy would they go through?
We have physical therapy, occupational therapy, and also speech therapy. We have a full kitchen that the occupational therapist will work with them for things like loading a dishwasher, working with a stove or an oven, to really get them back and make sure that they're really ready to be back home and taking care of themselves.
And you have therapists that deal with each individual?
Yes, everybody has an individualized care plan, and they're all taken care of individually.
I'm here now with Julia Beal. She's the ARCH Program Director at Helia Healthcare of Champaign. What is an ARCH Program Director?
Well, what I do is I ensure that when patients come to the ARCH program, which is our bridge program from hospital to home, I make sure that they have everything that they need to get home as quickly as possible. I welcome them with open arms. I give them their medications. I ensure that their care plans are on point and that they're meeting their goals so that they can get home quickly.
So do you work with both guest and family in doing this?
Absolutely. It's all encompassed with the family because ultimately they're going to be the ones that are watching over their loved one when they go home, and they're going to have a lot of questions too because there might be some changes in how that they have care and what they do with their activities of daily life once they go home.
What's your biggest challenge in doing that?
I would say there's 2 big challenges with when we get a guest here at the ARCH. One is building up their strength and coordination in therapy, and 2, getting the right attitude on board so that everything works and is effective for them to go home quickly.
And your staff works closely with each individual to make sure that they reach their potential.
Yeah, the great thing about the ARCH is we have an awesome therapy program with amazing equipment. We have state-of-the-art equipment, including virtual reality. And then the therapy doesn't stop there. When they're not in actual therapy in our great therapy room that we have here at Helia, they are actually getting therapy with the CNA every time they go to the bathroom. They are constantly talking with therapy to see the progress that they've made and what they need to work on. So the CNA and the nurse, when they're helping them do activities during the day, they can actually incorporate the therapy tricks that they use in therapy to help them get along and move faster. So it doesn't stop there. It's all throughout the day.
And once again, the ultimate goal in the ARCH program is to
Go home.